Good evening, class. My last presentation will be about a treatment plan. How to present a treatment plan when you're at the dental office. First, after the patient has been spending time with the dentist will put all the codes into the system, what the patient will need. Then it will be my job to see how many options the patient has, and I have to make him or make her a treatment plan. And this is how a treatment plan sheet looks like. It will say on the top, treatment plan. We will have the account number of the patient, and we will have the date of the same date that the patient has been discussing the things with the dentist. Obviously, we will know the patient's name because it will say it right here on the top. Each section shows the different steps in the procedure, what it has to get done first and second. And on this column, we'll show the fee. If the patient has insurance, what the insurance will pay. And the third one, what will be the patient portion. So here is how it's done. Hello, Mr. Zico. How are you?
Hello, I'm fine. How are you?
I'm good. Thank you for asking. My name is Mira, and we will discuss your options, what you and Dr. A have talked about. Is that okay?
Okay, nice to meet you, Mrs. Miller. And I'm very happy when I'm today with you. And I want to discuss about this.
Thank you. So, you are aware that your tooth has to be pulled out, correct?
Yes.
So we have two options. Your first option will be the removal of the tooth and replace it with an implant. And for your second option will be to remove the tooth and replace it with bridge. Let me show you what procedures you need. So your first option will be the implant. So you will need to get the removal of the erupted tooth. So they will pull out your tooth and there will be a missing space. Then you need to get a bone replacement, which means that after they pull out your tooth, you're not going to have any bone or anything. So they need to make you one. And then the guided tissue region. So in the region where will be the bone, they will make it good for you in order not to feel any pain and for you to feel comfortable.
Okay.
This will happen in one appointment. Your second appointment will be the implant.
Can you tell me, please, what is implant plan?
The implant is an artificial tooth. It will take a few steps in order to get it done. For the second time when you come to get the implant, you will not leave the office with a tooth. You still have the missing space because the first time they need to put the implant, which will be known as the replacement bone. So this will be your fake bone. Then the third time you come, they will make you a custom abutment, which means that they will make like a little chair on top of it, and then on top they'll put the cap, which will be the crown. So it will look like a little light bulb.
Light bulb?
Yeah.
Oh, I like light bulb. Okay.
And your second option will be to remove the tooth and get a bridge.
Bridge. Okay.
But this is a little bit different though because it will involve two additional teeth. After they remove your tooth, the space between, there will be two teeth involved. So they will make the crown for where the missing tooth is. They'll get the pontic and another crown. And all this will be made from porcelain. So both crowns will go on top of the tooth between the missing space where your erupted tooth has been. So it will go on top, it will cover them.
Thank you for all this information, Mrs. Miller. I want to know now what my insurance coverage, and did you have some plan for payments for this?
With which option do you want to go with?
But I will use first option.
The implant?
Yes.
Good choice. I
Thank
would
you.
also recommend
Thank
this.
you. I know I have good choice all the time.
After your surgical removal of the tooth and the bone replacement, you will max out your insurance, which will mean your insurance will not pay for anything. But let me show you. This will be the fee for the removal of the tooth, which will cost $265. Your insurance will pay only $132.50, and you'll have to pay the remaining. But if you do not want to use the insurance, we will give you a discount. So instead of you paying more, we will save you money. So the price for the removal will be $176. And after all the steps, you'll end up saving $3,275.
It's good. It's good, very good. Thank you.
But in order for payments, you can sign up for monthly payments, or the other option you have, it's called Credit Care. And this is this is a credit card. It's the same thing as credit card, but you will use it at any dental office. It's really good. I highly recommend it. Their interest charge is very, very, very low. So anybody can sign up. It takes less than 10 seconds.
10 seconds.
Yes. I can give you the application here, or if you want, you could take it at home. We will fill it up for you, and within 5 seconds, you will find the answer whether or not you have been approved and what will be your maximum credit. So here is the table interest. This will be for you. You can keep it.
Okay, thank you.
And if you want, we have decided to go with the implant, so we can take a look how much you will end up saving even more if you get approved. So the whole procedure will, if you go with the insurance, will be $6,285. This will what the insurance will pay, $1,050, and you'll end up paying $5,236, which is more.
I have to pay this, yeah?
If you go with the insurance. But if you do not want to go with the insurance,
it will be more.
It will be less. You will pay about, about $3,000. So for the $3,000, there is only, let's see, you only have to pay $3,600. So if your credit limit is 3,000, you'll just need to pay the extra for the fees if you're late each month.
Yeah, I understand. Thank you for all this information, Mrs. Miller. And after this, we can do it.
Thank you for being our patient, and this is for you to keep.
Thank you.
Thank you. Have a good one.
Thank you.